I am Fiorella Belpoggi. Thank you to be here, and I apologize not speaking Italian because I have seen that people from Italy are a certain number, but I was asked to speak English because there are a lot of other attendants that would like to understand me. So I was the scientific director of the Ramazzini Institute, which is a social cooperative with more than 38,000 associates. So a big organization of citizens that financed the most part of our studies. So the study that I am going to present are the study of citizens. I would like to tell you about our experience in the field of electromagnetic fields. We studied the extremely low frequency electromagnetic field, the one from electricity, then the mobile phone at the frequency of the 3G, and very close to also to the wireless and 4G of nowadays. But we studied in the past also gamma radiation that are ionizing radiation. So in the last 20-30 years, the major part of our studies were concentrated on physical carcinogenicity. What we know as official data up to now, what we know is that electromagnetic fields, radio frequency electromagnetic field, are possible carcinogen, and this was stated by the classification of 2011 by the IARC. At that time, there were limited but present. There were few, not inadequate, studies on humans, and there were no studies on radio frequency at that time. So the studies that were available were very poor, and so not able to give good results for risk assessment. But in particular, the studies, in the epidemiological studies, were seen by Hardell and also by the Interphone study group, the increase of brain tumors in the big users, in the heavy users like manager and people that use the phone also for their occupational activity, and the vestibular schwannomas, that are tumors of the vestibular nerve, that is the acoustic nerve. So on the basis of this data that were not sufficient to say probable carcinogen, IARC classified them as possible. But in the frame time from 2011 and 2018, both the National Toxicology Program in the United States and the Ramazzini Institute in Italy performed two huge experiments with a huge number of animals and at doses that were comparable to the one that could be the one to which the human being are exposed. In particular, the National Toxicology Program study was concentrated on the near field. They reproduced in their exposure system the situation of an emittent device close to the body. On the contrary, at the Ramazzini Institute, we studied the far field, that is the one that is to which the human population is exposed in everyday exposure. So if you look to this slide, you see that the rats were located in 4 rooms, all with this kind of exposure system, in rooms shielded in order to minimize the effect of field non-uniformity, based on the not to having not the possibility of reflection or interference caused by the walls. The cages were located in a wooden circular-shaped device with single exposure in the middle, that is an antenna, and every of these, let me say, little condominium were located about 400 rats. All devices were identical, and the only thing that was changed, the unique variable, was the intensity of the electromagnetic fields. If we compare the exposure in voltmeter to the SAR, that is the specific absorption rate, you will see that these are very, very close to the SAR that is admitted in human, so very, very close to the human exposure. The one of the NTP study being a near field exposure were higher, a lot higher, in the case of 6 watt kilogram. So what we have seen, what kind of experiment we did? We had a project in which we studied electromagnetic field alone, that is this one, with close to 2,500 animals, already partially published, as you know, the data on brain tumors and harsh phenomena were already published, and another study in which we combined the electromagnetic fields to one shot, one unique exposure to gamma radiation at very low doses, comparable to a total body TAC. So in this case, you see we had the 50 voltmeter and the 25 voltmeter combined to 0.01 gray. That is just the quantity of radiation that are emitted during a total body TAC. So,
okay.
what is the result? The results are simplified and never published. This is the first time that I show this study, because we have not yet had the financial support to conclude the whole study. But we observed during the in-life period some data that I would like to present. For example, we noted that the fertility index, this is the control, all the matched females delivered their puppies, but in case of the combination with the electromagnetic field, radio frequency electromagnetic field, the fertility index was lowered, and also the pregnancy index. All the female became pregnant, but only 76% and 64% when we combined the electromagnetic fields with the gamma radiation. And another parameter that we measured was the weight, the mean weight of the puppies. As you see, the puppies are very small, so the difference is at the level of grams, but there was a difference. This show a very big interaction of radio frequency electromagnetic field with other kind of carcinogens and with other kind of dangerous exposure in our environment. And I am really eager to see what is the final results, because I think that also in other pathology we could see differences. And another parameter that we noted were the lumps of the mammary gland. These are the female of the different group. As you can see, the percentage of lump in the case of both exposure, simultaneous exposure to gamma radiation and radio frequency, increased the number of benign and malignant tumors. This was a clinical observation during the control that we performed every week during the life of animals. But we pass to the results of the experiment where RF-EMF were administered alone. As regard brain and heart, the National Toxicology Program and the Ramazzini Institute had the same results in terms of site of onset of the tumors. The increase of brain glial cell malignant tumor, and an increase also, if not significant, in females in our study. And as regards the heart, we observed malignant schwannomas and hyperplasia of the Schwann cells, both in male, both in the study of the American study and the Italian study. Consider that these are very, very rare tumors, and pathologists in front of such increase know that could be some effect due to the exposure of particular agents, in this case radio frequency at the dose of 50 voltmeter in our case, and 25. So this was a data that enforce and give strength to the results of the National Toxicology Program, because the doses were lower. The observation was in both experiment from the pregnancy, the 12-day of pregnancy of mothers, and in our case continued for the whole lifespan. So it is just the similar situation that we have in humans. But what is this kind of tumor that we observed? As I told, is a tumor of the heart, and is a very, very rare also in humans. Believe that we have registered lesser than 20 cases in the world in the last 20, 30 years, so really very rare. But you know, what makes us suspicious is the fact that this tumor could not be seen by the usual examination that people with stroke could investigate with an autopsy. So we really don't know if in humans we have an increase or not. So it is just a small layer of this neoplastic cell that is in the endocardium. So the kind of symptoms that we can find is just an insufficiency of the functionality of the heart. So we have not something that is visible without very deep examination. But how much they grew? As you can see in the control group, we observed 0. In the 5 voltmeter and 25 voltmeter, we noted that there were 1 case of this tumor, but this is a range that is among our historical control of more than 20,000 cases of control that we have examined in 50 years of activity. Here the increase was 1.4, that is statistically significant compared both with the historical control and the treated animals. So it's true, there are not so many. In the study of the National Toxicology Program, they increased more because the dose was higher. So the fact to observe the same kind of tumor put us in alarm. And we published very quickly the data as soon as we observed them in 2018. Another observation that we have done later, we would like to see what could be the level of exposure safe for human. And comparing all the data with the specific statistical evaluation, we found that just the 6 voltmeter that were allowed in Italy, for example, could be considered a safe level of exposure. For this reason, in the last 4 or 5 years, I fought a lot in order not to change this level, that unfortunately, with this government, was increased to 15 voltmeter. But at 25, remember, we have seen only a small increase of this tumor, but 50 is an allowed level of exposure in North Europe, for example, in other countries than Italy. Only Switzerland and Bulgaria, for my knowledge, have level very similar to the one that we consider safe. So another observation, it is true that the increase of brain tumor was not statistically significant in females of our study. But if we look to the trend of the increase, there is a statistically significant dose response. This means that the increase was due to the exposure to radiofrequency. The difference between sexes is very common in carcinogenicity, as it is in humans. For all kinds of tumors, we have a major incidence in one sex instead of the other, stomach, intestine, liver. So the hormonal metabolism could improve or decrease the development of tumors. And this was observed not only in this experiment, but also in other one. 210 compounds were studied in my laboratory in 50 years of activity. So I had also the privilege to prepare a report for the European Union, and they asked me what were the health impact of 5G. And in this occasion, I had the possibility to examine more than 8,000 papers of the last 30, 40 years. And I divided the frequency of the different radio frequency exposure in two groups. The first one that was going from 450 to 6,000 megahertz. And the other one, the frequency to which we expect to have the 5G. And what I found that at the frequency that are already in place, and now we have some of the frequency also of the 5G, but at this frequency there are reproduction and developmental effect, both in male. In male was very evident and statistically significant in all the epidemiological and experimental study, but also in female. And as regard cancer, I can say that the study of carcinogenicity in humans gave the result that they are probably carcinogenetic both for brain and schwannomas of the air. And no adequate study was available about microwave, both on cancer and reproduction and development. We were astonished in last September when WHO published the results of the working group on the epidemiology that they established, because I look at to the studies. There were a lot of study adequate, and so I think that the data are sufficient to say that there is also, if limited, but certainty of the carcinogenicity. What they said was really confusing, because they said that there was or a moderate or low uncertainty. What means? I don't understand what it means. Low uncertainty means that there is some certainty, and moderate means that we have some uncertainty, but not that they are safe. So myself and other colleague in Italy wrote an article, a letter to the journal that is Environmental International, to criticize this work. But another thing that I would like to tell to you, the WHO that nowadays has lesser funds thanks to new President Trump in the United States. But at that time, when the money was available, they established the IARC. IARC is just the agency who has in care the evaluation of the carcinogen, of the pollution in general that can expose people both at work or in the general environment. So I don't understand why they established an ad hoc working group where the major part of the participants were members of ICNIRP. And I think that all of you know very well what is the opinion of ICNIRP, that negate completely the biological effect of radio frequency. So these are questions that should be replied by WHO. We wrote this letter to the editor. You can find it on the website of Environment International, where we criticize and we go in deep in our critics. But here, if I have the time, have I the time, Giorgio? I could still 10 minutes.
There is 5 minutes left.
5 minutes, okay. And I am bringing here some results that are not mine, but I believe that could be informative. It is a study, in particular, I will present this data, of 168 pupils of the secondary school in Tuscany. What was observed? For example, the young people from 10 to 16 years, as you see, there are 3 years considered, because the school was studied for 3 consecutive years, and there are the same boys. As you see, for example, the chatting decrease and the playing decrease, but increase, for example, the use of Facebook, of social network, and so on. But go very quick on it because I have no time. Anyways, the percentage of people who turn off their smartphone at school is fortunately increasing. The percentage of pupils who turn it off while studying and when they are with friends is decreasing. So when they study, they use very much also the phone. And the number of those who turn it only when they need it drops to 0. So this has a big significance in our evaluation, because is a changing in the use of mobile phone that could be related to all what Professor Pellai told us before. What is nice to be told is the percentage of people who keep it under the pillow at night decreases. And this is already a good result from the health point of view. There is a high percentage that who keep it in their pocket, and the trend of friendship, amicizia in Italian is friendship, is increasing, friendship on internet, and the profile in social network decreased from the first year, but we think only because increase the age. So when they are curious, they are younger, they think to become adult using this kind of means, and then they use just in order to communicate to other friends. Increase the percentage of prescribable correct behaviors, so disregard parents. No nessuna means no one will give any suggestion. But here, the parents that before didn't suggest any attention for mobile phone, now they are suggesting to their children not to use too much the mobile phone. The interest in school training from parents to teach is growing, and is a very, very important, because I think that before they were not so aware about the risk in the use of the mobile phone. And when we ask, why do you think they are dangerous, increase the perception of growing addiction and decrease the awareness of cancer risk. They believe that it is very far, the risk of cancer, but they are worried, the parents, about addiction. It is already something that is good. And so, in conclusion, internet service have changed the way of using portable devices by pupils and parents, which remain on almost always during the day, fortunately. Smartphones are taking the place of tablets and laptops. We perceive portable devices as increasingly indispensable, and at the same time, we feel more the risk of becoming addicted. Parents warn that technology is changing and feel the need to be supported in education and training on an increasing conscious use of devices. So there was a change, and this data, the last data, were collected in 2020. So in these 5 years, surely there was another change. But when we put a probe on the boys for some days during the week, what we see? That the most of people is exposed to more of 3-volt meter, very much to more than 6-volt meter, but in the last year also the number of exposure above 10-volt meter as a huge amount. So the exposure of children at the time when in Italy we had 6-volt meter was above the limit of law. If we ask, if you were forbidden to use your phone until 16-year-old, what would you think? I hate you, sorcerers. Would beat them. I would think my parents want to piss me off. That those who are 16-year-old are lucky, that they are unfair and do not like the technology of this world. So the reaction is very, very strong, just as an addicted guy. And what do you do? I would participate in protest demonstrations.
Sorry, Fiorella, sorry, you have 5 minutes already, over 5 minutes.
No, but I have finished. I make no difference as long as they don't take my Xbox. I would organize a non-violent protest movement like Gandhi. I would kill you. I beg them and make proposal. I get angry and buy it with my money. I wouldn't last a second. I would go out more often with my friend. And this is the positive answer, but were very few. But when you ask to them, are electromagnetic field dangerous to health? They respond yes, the 100%. That could be mental health and physical health. So the Ramazzini Institute promoted in all schools of Bologna and province a campaign where there are things to be done, that is this, and things that could not be done. And we had a huge success, and we are requested to go in school very, very often. And at the end, I would thank the staff that worked with me in this important study that I presented you. But I would like also to mention that at the end of the last century, Cesare Maltoni, my leader and mentor, already planned this study and was planned with him. And this is the castle where we have our laboratory. Thank you very much.